So I was a nurse by trade. I trained in Northern Ireland, hence the funny accent. And then I came to England to work as a nurse. At the time in Northern Ireland, it was very difficult to get a nursing role that was a permanent role because people don't tend to leave Northern Ireland. So I came to England with I think the view to travel, actually, to do some work here as a nurse and then move on travel. And I didn't get much further than London, I have to say. I loved London. And there was a Darcy report that came out by Lord Darcy that was looking to move a lot of the services into the community. And they needed people to be able to function in that respect and to move those services out. They needed a bigger workforce. So there was a healthcare practitioner role that came up, and it was about a hybrid model, about looking about how we can blur lines within professional roles. So I did that for a couple of years. And then there was another role that came out from the Changing Workforce programme called a medical care practitioner, which was really the precursor to the PA role in terms of, you were seeing the common and important conditions coming through healthcare. And more into diagnosis and treatment and management of those patients. And then that role happened around the same time as the committee that was set up to look at physician assistants and about how we could have a competency curriculum framework in the UK for physician assistants. So that was all kind of going on at the same time, and at the same time the USPAs were here working. So 2013, we have been pushing for regulation of the profession for 10 years, a long time. And in 2013, our government said, well, actually, your title doesn't do you any favours. At the same time, because the title is not protected, then other people were calling themselves physician assistants, but they were technical roles. And so we went out to consultation with our membership from our professional body at the time, which is UCAPA, the UK Association of Physician Assistants and then Associates. And actually, it was overwhelming support for a change of the title from our membership. So I think it takes away from that sort of handmaiden title that you get with assistant, that actually you work in conjunction rather than in subordination to someone, almost, which is the assistant title. And I know in the US they've been trying for a long time to change that. But I understand as people are legislated by states, that's an awful lot of state law that needs to be changed.